I first want to just acknowledge that I am residing on the unceded homelands of the Communum and the Squamish-speaking peoples. And I want to extend the appreciation for the opportunity to present my project on this territory. First, I also want to just give you a brief synopsis of my practicum experience, as well as provide a little bit of context about my literature review, which I conducted. So I completed my practicum with Vancouver Coastal Health, specifically the Tobacco and Vapor Reduction Program. And I want to just give a big shout out to Lindsay McDonald, who was my coordinator for the practicum over the last 6 months. She was great in facilitating my learning experience. So thank you, Lindsay, for that. So the Tobacco and Vapor Reduction Program at Vancouver Coastal Health consists of 3 important pillars. And this is prevention, cessation, and protection. So the protection side of things is facilitated by tobacco enforcement officers who will go out and do inspections of different retailers, and they will ensure compliance with provincial legislations around tobacco products and vapor products. So they will go into these businesses, check for like labeling and advertisements, and making sure they're not selling, any of these products to minors, things like that. The other side of things is the prevention and the cessation aspect, and this is facilitated by tobacco and vapor reduction coordinators, whom I had the pleasure to work with during my practicum. And their ultimate goal really is to reduce vaping and tobacco consumption within the community, especially public settings like healthcare sites and schools. And they do this through engagement with community partners as well as members of the public. They will provide guidance and resources on tobacco and vapor products, and they will implement programs and interventions around, prevention and cessation. So why does VCH have this program exactly, as well as, other health authorities? It's not just VCH that has a tobacco and vapor reduction program. Why is this program actually important? Well, we've known for a long time that cigarettes are bad, right? We know through decades and decades of research that, smoking cigarettes can lead to some adverse health outcomes long term. And but what we've been finding lately, especially over the last decade, is that amongst youth, cigarette consumption has been on the decline, which is great. But on the other hand, the use of e-cigarettes has actually been increasing, and this is a bit of a problem. Well, we technically know that using e-cigarettes, can be, better alternative to actually smoking cigarettes. But the thing is, these youth, they're not exactly using e-cigarettes as a smoking cessation tool. They're getting hooked on e-cigarettes, and we know that through some recent, studies that have been conducted, that especially for youth who are undergoing like an important developmental phase in their life, that using these products can have negative outcomes for their mental health as well as their physical health. So why do youth actually use e-cigarettes? Well, why do youth actually use e-cigarettes? Well, through several provincial and national surveys that were conducted, some risk factors were identified. And, youth who are experiencing mental health problems, especially anxiety, depression, who are maybe living in disadvantaged communities, maybe experiencing discrimination. So engaging in substance use can actually lead to using e-cigarettes. Of course, we also know that peer pressure is another factor, as well as misinformation that is found online, aggressive marketing campaigns by these companies, as well as high nicotine concentrations in these products. And of course, fruity flavors that are just numerous amounts of these flavors can also contribute to cigarette use. Is flavors especially because it can actually, draw kids into using these products, and then contribute to the reward mechanisms in the brain, contributing to nicotine addiction. So currently, e-cigarettes are a big problem for youth that are addicted to these products, for parents, for teachers, for healthcare providers, and there needs to be interventions in place that will target youth and help to educate them on these products, as well as help them and support them in their cessation efforts. However, due to the novelty of e-cigarettes, there just isn't that many interventions currently out there, and there isn't a lot of studies that have been done to evaluate these interventions to figure out what works and what doesn't work. And this brings me to my literature review that I conducted, which is to try and identify all of the current prevention, protection, and cessation interventions that can be, provided to youth, as well as determine how they were developed, what kind of frameworks were used in their development, if they are based on best practices or evidence-based, as well as synthesize any sort of evaluative evidence around these interventions. And I think this is important because it will help to guide the development of future interventions and help to improve the interventions currently in place. So how did I do this review exactly? Well, I conducted a literature search using Medline database, and I also used I did a gray search of using Google. And I think the gray literature search was actually very important because a lot of these interventions don't actually have published literature. So in order to capture the entire scope of interventions, I had to really, Google was probably the primary source for that. And so in total, identified 26 interventions that can be implemented. 12 of them were focused on prevention, and these include like health messaging campaigns, peer-led programs, school-based education. 10 interventions were focused on cessation. So these included like support services, group meetings, as well as pharmacological programs. So things like nicotine replacement therapy, for example. And then 4 interventions were focused on prevention. So this included changes in policy and legislation at the government level, as well as community level and within schools. And after reviewing these interventions, there are some key takeaway messages that I extracted. First, effective interventions will often utilize normative education principles and social and emotional learning. And this was very instrumental in having effective interventions. The interventions were also grounded in evidence or framework that promotes behavioral changes, such as the stages of change theory, as well as the theory of planned behavior. Effective interventions were also free of cost. They were accessible online or through multimedia devices such as cell phones. They were cost effective and then optimized for reach. What I also found was that protective policies and punitive punishments are not always effective at reducing e-cigarette consumption. So for example, somebody like a youth being caught at school and then being disciplined for using e-cigarettes, this does not actually produce long-term lasting behavioral changes. What it creates is distrust between, the school administrators or other officials, and creates a divide between youth and these officials and administrators, and it actually can promote e-cigarette use in the future. Overall, environments must be supportive for youth. They, either at home or within the school, and combination of measures have to be taken to reduce e-cigarette consumption, beginning with education at an early age. Some challenges I found with these programs is that interventions often combine tobacco and vaping into a single intervention. We know that tobacco products and vaping products share some similarities between each other, but there's also big differences between these products. And what works for tobacco might not work well for vaping cessation. So having these two pieces be separate from each other is important. And the other challenge I found was that a lot of interventions just have not been formally evaluated, whether that is because these e-cigarettes are very novel, and there just hasn't been enough time to evaluate these interventions, or the other aspect is funding. Just not a lot of money is being poured into actually finding solutions and evaluating solutions. So this is a gap that can, of course, be addressed. If we learned anything from cigarettes for over the last 20 to 30 years, is that we need to take action now, and we need to be proactive as opposed to being reactive. Otherwise, we're going to end up with a large population of youth and young adults that are addicted to nicotine and potentially suffering some severe health outcomes in the future. And that brings me to the end of my talk. Thank you for listening in.